Never use ginger if you have these condition. Hello everyone. Welcome to my channel. In this video, I will talk about 10 conditions you should avoid ginger if you have them. Ginger is an herb with numerous health benefits, including aiding digestion, boosting immunity, fighting inflammation, and relieving nausea. But ginger is not for everyone. There are some situations where ginger can cause more harm than good. So, let's find out what they are. 1. Underweight. Avoid ginger if you are underweight and have a low body mass index. Ginger can suppress your appetite and reduce your food intake, leading to further weight loss. Ginger can also interfere with the absorption of nutrients and vitamins, which can cause deficiencies and health problems. If you are trying to gain weight, limit your ginger consumption or consult your doctor before using it. 2. Blood disorders. If you have a blood disorder that affects your blood clotting, such as hemophilia, von Willebrand disease, or thrombocytopenia, you should be careful with ginger. Ginger can thin your blood and increase your bleeding risk. Ginger can also interact with blood-thinning medications, such as warfarin, aspirin, or clopidogrel, and make them less effective or cause side effects. If you have a hematological condition or are on anticoagulant medication, it is advisable to abstain from consuming ginger or consult with your physician before its use. 3. Diabetes. If you have diabetes or take medications for diabetes, such as insulin or oral drugs, you should monitor your ginger intake. Ginger can lower your blood sugar levels and affect your insulin sensitivity. This can be beneficial for some people with diabetes, but it can also cause problems for others. It's essential to be aware that ginger can reduce blood glucose levels, leading to hypoglycemia. Hypoglycemia can cause unpleasant symptoms like dizziness, confusion, sweating, or fainting. If you have diabetes, it's crucial to monitor your blood sugar frequently and consult your doctor before consuming ginger. 4. High blood pressure. Suppose you have high blood pressure or take medications for high blood pressure, such as beta blockers, calcium channel blockers, or angiotensin-converting enzyme inhibitors. In that case, you should watch your ginger intake. Ginger can lower your blood pressure and relax your blood vessels. This can be helpful for some people with high blood pressure, but it can also cause complications for others. For instance, ginger can enhance the effects of your blood pressure medications, significantly decreasing your blood pressure and leading to hypotension, which can cause symptoms such as drowsiness, blurred vision, headache, or fainting. If you have high blood pressure, you should check your blood pressure frequently and talk to your doctor before using ginger. 5. Gallstones. If you have gallstones or a history of gallbladder problems, you should avoid ginger or use it with caution. Ginger can stimulate bile flow from your gallbladder, which can help with digestion and liver function. But ginger can also increase the risk of your gallstones getting stuck in your bile duct and causing a gallbladder attack, which can cause severe pain, nausea, vomiting, fever, or jaundice. If you have gallstones, you should consult your doctor before using ginger. 6. Heart problems. Individuals with cardiovascular ailments such as coronary artery disease, congestive heart failure, or arrhythmia should exercise caution when consuming ginger. Ginger can affect your heart rate and rhythm and interfere with your heart medications. Ginger can cause irregular heartbeat, chest pain, or shortness of breath, which can worsen your heart condition or trigger a cardiac event. If you have a heart problem, you should talk to your cardiologist before using ginger. 7. Pregnancy. If you are pregnant, you should limit your ginger intake to no more than 1 gram per day and consult your obstetrician before using it. Ginger possesses the ability to alleviate feelings of nausea and vomiting in some pregnant women, but it can also increase the risk of miscarriage, bleeding, or premature labor in others. Ginger can also affect the fetus's development and the mother's hormones. Ginger is especially risky during the last trimester of pregnancy, when it can induce contractions and labor. 8. Breastfeeding. If breastfeeding, you should use ginger cautiously and talk to your pediatrician before using it. Ginger can pass into breast milk and affect the nursing baby. Ginger can cause allergic reactions, diarrhea, or colic in some infants, but it can also have beneficial effects, such as boosting immunity, digestion, and appetite in others. The effects of ginger on breast milk in babies are not well studied, so it is better to be safe than sorry. 9. Allergies. If you are allergic to ginger or other plants in the same family, such as turmeric, cardamom, or galangal, you should avoid ginger or use it carefully. Ginger can trigger allergic reactions in some people, such as rash, itching, swelling, or difficulty breathing. If you have a history of allergies, you should test a small amount of ginger on your skin before using it and stop using it if you notice any signs of an allergy. 10. Surgery. Before your scheduled operation, it is advisable to discontinue ginger at least 14 days in advance and promptly notify both your surgeon and anesthesiologist. Ginger can affect blood clotting and blood pressure, elevating the likelihood of hemorrhaging or complications during and after surgery. Ginger can also interact with some anesthesia drugs and cause adverse reactions. Ginger can delay your recovery and healing after surgery, so it is best to avoid it until you are fully recovered. So, these are the 10 conditions for which you should avoid ginger if you have them. Ginger is a beautiful spice and herb that can offer many benefits for your health, but it can also have some drawbacks and dangers for specific people and situations. Therefore, you should always use ginger with caution and moderation and consult your healthcare provider before using it. I hope you found this video helpful and informative. If you did, please give it a thumbs up and subscribe to my channel for more videos like this. Thank you for watching, and I'll see you at the next one. Bye.